At the moment, the world is threatened by the pandemic named as COVID-19. This is a project done to promote the information given by the World Health Organization to ensure the awareness of our community regarding the steps taken by the United Nations for this crisis. In this video, we will be looking at Part 3 of the COVID-19 calendar, from the 17th of February to the 1st of March 2020. On February 17th, based on lessons from H1N1 and Ebola, WHO outlined planning considerations for organizers of mass gatherings in light of the COVID-19 outbreak. It has also issued advice on how to detect and take care of ill travelers who are suspected COVID-19 cases. Throughout the week, WHO had shipped supplies of personal protective equipment to 21 countries. By the end of the week, 40 countries in Africa and 29 in the Americas had the ability to detect COVID-19. On February 21st, special envoys on COVID-19 were selected. The WHO Director General appointed 6 special envoys on COVID-19 to provide strategic advice and high-level political advocacy and engagement in different parts of the world. On the 24th, UN Secretary General Antonio Guterres met with the WHO Director General and other WHO leaders, receiving a briefing on COVID-19, Ebola, and polio. He expressed great admiration for health workers, including in China, who are working tirelessly to save lives. The UN Secretary General also stressed that there is no space for stigma and discrimination and said we must be guided by science and human rights-based interventions. Starting from February 25th, the WHO Director General had repeatedly called for solidarity, not stigma, to address COVID-19. WHO has worked with UNICEF and the International Federation of Red Cross and Red Crescent Societies on a guide to preventing and addressing the social stigma associated with the disease. It's vital to fight stigma because it can drive people to hide the illness, not seek health care immediately, and discourage them from adopting healthy behaviors. This guide includes some tips and messages, as well as do's and don'ts on language when talking about COVID-19. On February 28th, in a daily COVID-19 press briefing, the WHO Director General said that more than 20 vaccines are in development globally, and several therapeutics are in clinical trials, but we don't need to wait for vaccines and therapeutics. There are things every individual can do to protect themselves and others today. A list of them are given. On March 1st, UN Humanitarian Chief Mark Lowcock released $15 million from the Central Emergency Response Fund to WHO and UNICEF to help fund global efforts to contain the COVID-19 virus. This grant was to help countries with fragile health systems to boost their detection and response operations. It funds essential activities including monitoring the spread of the virus, investigating cases, and the operation of national laboratories. The announcement came as the World Health Organization upgraded the global risk of the coronavirus outbreak to very high, its top level of risk assessment. The WHO had said there is still a chance of containing the virus if its chain of transmission is broken. This brings us to the end of Part 3. You can access more information on the official websites of the United Nations and World Health Organization. Until we meet again in the next part, be sure to keep clean and stay safe.